Focus the light on the nose of the patient. We'll examine the frontal sinuses for any tenderness. We'll examine the ethmoid sinuses for any tenderness. Then we'll examine the shape of the nose. This patient has got small hump on the nose. You can see the hump. Then we'll examine the vestibule of the nose by tilting the tip of the nose, and we can very clearly see that the septum is coming into the right side of the nasal cavity. The left side of the nasal cavity is clear. So this is a very clearly, the nasal septum has come out of the columella. This is columella. It has come out of the columella and is lying in the vestibule of the nose. The vestibule of the nose is the hairy part of the nose. Any boil or any other infection like vestibulitis can be very painful. This is called the danger area of the nose because infection from this part of the nose can travel through the nasal bones into the ophthalmic nerves, ophthalmic veins, into the cavernous sinus. Now, with the help of this theodiculum nasal speculum, we will hold the theodiculum nasal speculum like this, then this and this. So we will put the nasal speculum like this. We will point the finger towards the examiner. We will hang the nasal speculum and we will bring the middle finger here and the other finger there, and we will compress it like this. Yeah, and this. Now we will examine the nose of the patient with the help of the theodiculum nasal speculum. We will compress the nasal speculum, put it in the nasal cavity, and then dilate the nasal cavity, and then we can see the nasal septum, the lateral wall of the nose, and the floor of the nose. Nasal septum, a lateral wall of the nose, and the floor of the nose. And we will press it and bring it out. Similarly, we will put it on the other side. See the nasal septum, which is coming out, and the lateral wall of the nose is not visible on this side. So this was examination with the help of the theodiculum nasal speculum. For examining the posterior part of the nose, we have to do posterior rhinoscopy, which won't be asked in your examination.